Now I'm going to talk about our clinical findings. This includes our lab values and diagnostics. And I'm also going to speak a little bit about our differential diagnosis that we're trying to work through in order to reach our final diagnosis for the patient. So we did some lab values today and some findings that were discovered. Obviously, one of our first labs we wanted to determine was our rheumatoid factor. This is a type of antibody that's found in about 80% of rheumatoid arthritis patients. And it's an antibody that attacks healthy tissue and it leads to joint inflammation. She was on the low positive end of this, which is an abnormal finding. Another exam that we did was the CRP. So the CRP is a C-reactive protein. It measures inflammation and it's produced in the level. And what we're really looking at here is maybe some level of acute inflammation, which does look indicative of her values. She did have a 12 milligram per liter, which is above normal, which is supposed to be less than 3. Another test that was examined for labs was her ESR, or erythrocyte sedimentation rate. The erythrocyte sedimentation rate is another test, and this one has to do with kind of looking at an immune reaction. So this immune reaction is can be indicative of rheumatoid arthritis. So this is a measure of the red blood cells and how they sediment or clump together. And the rate of this can indicate inflammation because if they're larger and stick together, it takes a longer time for them to settle to the bottom of the blood tube. So we would see a longer length of time and a larger value. And that is what is displayed here. She had 32 millimeters per hour for her set ESR, where a normal upper threshold of normal for a female is 29. Her x-ray results also showed some radiographic changes that were typical of rheumatoid arthritis. So we did an x-ray of her hands and wrists. This did show some soft tissue swelling. Another measure that was noted was some loss of joint space, and a particular finding which is common in arthritis or rheumatoid arthritis is juxta-articular osteopenia. So some of the things that we wanted to rule out for her situation and her condition were systemic lupus, psoriatic arthritis, fibromyalgia, osteoarthritis, and gout. So this was what we were working among for our differential. And due to her clinical findings, her physical symptoms and complaints, as well as our lab values that are on the left and our radiographic findings, we did come to a conclusion of our final diagnosis being rheumatoid arthritis.